Hello, and welcome to How Patients Can Partner with Their Physicians to Optimize Treatment Outcomes, a patient insight webinar from the Bladder Cancer Advocacy Network. We'd like to thank Bristol Myers Squibb, the EMD Serono Pfizer Partnership, Ferring, Genentech, PhotoCure, and Merck for their support of the Patient Insight webinar series. My name is Stephanie Chisholm, and I'm the Director of Education and Research at Beacon. I'm joined today by urologist Dr. Sarah Psutka of the Seattle Cancer Care Alliance and the University of Washington in Seattle. Welcome, Sarah. It's nice to have you with us.
Thank you so much for having me.
Dr. Psutka is a urologic oncologist. She's an assistant professor of urology at the University of Washington. She received her AB in biology from Harvard College in 2003 and her MD from Harvard Medical School in 2007. She then completed an internship in general surgery and residency in urology at the Mass General Hospital in 2013. She earned her master's in clinical and translational science from the Mayo School of Graduate Medical Education in 2015. In 2018, she joined the faculty at the University of Washington, where she now practices. Her clinical practice is focused on the treatment of bladder cancer, renal cell carcinoma, and testis cancer. From a research standpoint, her main area of research interest is in the study and development of personalized, comprehensive risk stratification measures in patients with urologic malignancies, particularly bladder cancer. She's focused on developing a risk stratification program that will help patients better choose the optimal therapy for them, with the goal of not only improving personalized oncologic outcomes, but also patient-reported outcomes such as quality of life. She's committed to partnering with patients in helping them get through their treatment as successfully as possible, with particular interest in the preparation for surgery, which is our topic for this evening. And she supports patients through their survivorship period. So welcome, Dr. Psutka, and I'm going to turn the mouse over to you.
Okay, let's see. So good evening, everybody. I'm absolutely honored to be here. Just waiting to receive the mouse.
There you go. You should be all set.
Got it. Okay. Well, it's an absolute pleasure to be here. I am so excited to get a chance to speak with you all and to be a part of the Beacon webinar series. I am a tremendous fan of Beacon, and I'm very excited to talk to you about how we can work as a physician and patient as a team to help you get through your treatment, starting with diagnosis all the way through surgery and chemotherapy as best as possible. So what we're going to handle tonight is we're going to talk a little bit about just starting off what the diagnosis of bladder cancer feels like. And then we're going to go step by step through how we can put control back in your hands. And I think that generally when patients come into my clinic and they start asking me about their new diagnosis of bladder cancer, the first thing that everyone wants to know about are the statistics. But I have to say, the statistics about surgery for bladder cancer and statistics about survival can be really intimidating. And especially in the setting of a brand new diagnosis of bladder cancer, this can be almost overwhelming. I think that when patients first come in, it's not uncommon that we'll start talking and the details quickly can become very overwhelming. And I think that one of the hardest parts is then to have to work through some very complex decision making. And understand very discrete details about surgical choices, chemotherapy choices, a lot of which is pretty foreign to most patients, and try to make those decisions in the context of a real emotional blow. So what I want to do here is take it step by step. Our goal again is to put control back in your hands. And first we're going to start with preparation. So I'm just going to see if I can get my slide to advance. It looks like I may have lost the mouse, Stephanie. Are you able to advance the slide for me?
Yeah, I'm sorry, I just put myself on mute. So yes, you should be able to do that right now.
Okay. Almost there. I haven't got it quite yet. There we go. Okay, so let's talk about getting ready for therapy. We're going to cover a couple of different topics here, and I actually want to spend a fair amount of time talking about nutrition and weight, and specifically an area of research interest to me that actually has a lot of implications for how patients handle therapy for bladder cancer, which is thinking about muscle mass. We're going to talk about bad habits, that this is a great time to kick. We're going to talk about exercise, and I know a lot of patients say, Doc, you really want me to start working out right now? And I say, yes, this is the moment to get yourself in the best shape of your life, because we're about to go through a marathon together. We're going to talk about self-care, we're going to talk about sleep, and then I wanted to spend a little bit of time also thinking about how to best help, how we can help patients manage their anxiety, their worries, and their emotions as they're going through things. So we're going to take a step back and start out by talking a little bit about some science. One thing that is a very hot topic in bladder cancer research right now is the concept of obesity and what that means for patients with bladder cancer. And this literature, honestly, is incredibly complex to get through. The truth is, if you look at all the papers that have been written about obesity and bladder cancer, patients who are found to be obese, you can find papers that basically support the fact that patients who are obese have the worst possible outcomes with bladder cancer. You can see papers where obesity is not found to associate at all in any way, shape, or form with outcomes from bladder cancer. And then you can find papers where it actually seems like obesity might actually be associated with better outcomes in bladder cancer patients. So it's really hard to kind of make heads or tails out of all of this. So this was actually something I started studying back in 2013 when I was doing my fellowship in urologic oncology in my master's. And I got into trying to get at what the underpinnings of body composition is, and moving away from the idea of body mass index, which doesn't tell us anything about what a person actually looks like on the inside and simply conveys weight. And this is how I got interested in the concept of sarcopenia. So basically, muscle actually weighs more than fat. And so a patient who is extremely muscular oftentimes will have what might seem like a higher BMI than one would expect. And so what I have here are two CT scans side by side that are from patients who have identical BMIs, technically actually in the obese range if you look at the World Health Organization classifications for obesity. But what's really interesting is you can see the red, which is outlining the muscle in the scan on the left. There's a lot more red than there is in the scan on the right. And that's because these patients who have essentially identical BMIs have very different amounts of muscle mass. And this is an image analysis program that we use in our research lab. And so the concept of sarcopenia we're going to spend a little bit more time talking about, but basically what we're looking at here is a severe deficiency or a paucity in muscle mass. And this has been identified in the geriatric literature as being a really bad prognostic indicator. And so when I was in my fellowship, I started looking at whether or not this was something that associated with outcomes in bladder cancer patients. And so what's interesting is that we know that BMI, from what I just showed you, doesn't tell you much about what a person actually looks like, whether they have a lot of muscle or a lot of adipose tissue. It also doesn't tell us anything about their nutritional status. And this is some other research that I did, a paper that some students and I wrote while I was in my prior job in Chicago, which basically shows that as we go across the BMI categories on the bottom here, starting from what would be considered extremely underweight, or BMI less than 18.5 kilograms per meter squared, to all the way up to morbidly obese, which is a BMI greater than 40, we can see that albumin, which is a surrogate for one's nutrition, actually varies significantly. So you can be severely malnourished when you're underweight. You can also be severely malnourished when you're morbidly obese. And so this is important because when people are talking about, well, my doctor told me that my BMI is this, and therefore my outcomes are going to be such and such with all these treatments. Unfortunately, the BMI is actually a pretty poor prognostic indicator because it doesn't actually convey the information we really need to know. So let's get back to talking about muscle mass, because this actually becomes very helpful to start thinking about. So muscle mass, or sarcopenia, is the concept of the severe deficiency in muscle mass. And this is something that happens, unfortunately, in everybody. As we all age, we lose some muscle mass. We also lose bone density, and we see that as we age, our basal metabolic rate, or just how much energy we burn, goes down, and most of us gain some fat. So this, for example, is 2 CT scans of the thigh of the same person at the age of 25 and then at the age of 63. And what you can see is the patient at the age of 25 has significantly more muscle than the patient at the age of 63, when you start seeing a lot more fatty infiltration. This is the subcutaneous fat here, and then actually the fat within the muscle becomes much more robust as well. And so we looked at, when I was at the Mayo Clinic, we looked at how patients who were sarcopenic, so patients who basically had the lowest levels of muscle mass, how they compared to patients who had normal amounts of muscle mass, and we looked at what their overall survival was like after radical cystectomy. So the line on the bottom is the folks who were sarcopenic, and what was really interesting was this was actually 2/3 of all of the patients who underwent radical cystectomy, which represents the fact that a lot of patients who are being diagnosed with bladder cancer actually have fairly low muscle mass to begin with, and whether that's related to the cancer or to their other comorbidities, we don't know. But we do know that it seems to be across all the studies, patients who have bladder cancer tend to have a higher risk of also being concurrently sarcopenic. And then these patients up here on the top line are not sarcopenic. This is a survival curve. And it basically shows that as you go from 0 to 10 years after cystectomy, the patients who were sarcopenic unfortunately had shorter survival. So at 5 years, patients who were sarcopenic had 39% were surviving, compared to 70% of patients who were not sarcopenic. And we started to see these differences really early on, even as early as 90 days after surgery. So this pointed out a potential major risk factor that had previously not been acknowledged within the bladder cancer literature. And even when we started controlling for all kinds of other things, like how bad the actual tumor was, whether or not patients were smoking, and so on and so forth, sarcopenia was associated with almost 2 times or 2-fold increase in the risk of death after bladder cancer surgery. So this pointed out to us the importance of really making sure that we were helping do everything we possibly could to help patients stay strong as they're going through chemotherapy, immunotherapy, and then surgery. And a key component of that is nutrition. You really do need nutrition to stay strong and also to heal, because protein and nutrients are the building blocks that your body is going to use to recover from these therapies. Now we know, I want to talk a little bit about chemotherapy. It's very common these days that we use chemotherapy as a treatment to basically try to treat your entire body and rid your body of cancer cells before you go through radical cystectomy or removal of the bladder cancer. Now, unfortunately, there's a lot of side effects of chemotherapy. Chemotherapy is essentially a toxin, and we're preferentially trying to kill the cancer cells, but it's very hard on people's bodies. We know that side effects of chemotherapy include everything from nausea and vomiting to fatigue, commonly loss of appetite, and oftentimes weight loss. However, we normally think of weight loss as being something that when people eat a little bit less, they lose weight. A lot of times with chemotherapy, the body actually also starts to metabolize tissue faster, and so you can end up with really profound weight loss. And a big part of that is muscle loss. And so one of the concerns we had when I first got into this research was, well, are we actually making people potentially a little bit sicker with our chemotherapy and then asking them to go through bladder cancer surgery? And this was work that I did when I was at Northwestern. Basically, we looked at what happens to patients' bodies when we give them cisplatin-based chemotherapy prior to radical cystectomy. So in the approximately 2 to 3 months that patients got chemo, we looked at a total of just about 30 patients, and we saw that while one person gained some muscle mass, this is what happened to everybody else's muscle mass as they went through therapy, and this was over a relatively short period of time. And these are 2 representative scans. You can see here that basically the red component shrank in this patient. The muscle mass shrank as this person went through cisplatin-based chemotherapy. So what this really tells us is, now we know that the chemotherapy is important, because we know that the chemotherapy actually improves survival. So it's important that we use it. But now we're starting to understand what it does to patients' bodies. And so what that allows us to do is to then think about, well, how can we mitigate or how can we prevent these losses in muscle mass so that patients don't come out of chemotherapy feeling sicker or being less strong than they were when they started, especially since we're thinking about asking them then to go through a radical cystectomy. So there's a couple of things that we know can make a big difference, and this is an active area of research right now. Certainly, we know that nutrition is critical, and there are a lot of benefits to really maintaining and focusing on good nutrition during chemotherapy. One of the first parts is that this is something that you can control. And I think that patients talk to me a lot about the fact that when they get diagnosed with bladder cancer, they feel this profound sense of loss of control, because all of a sudden, everything that was moving along in one direction is not going so well. It's almost like the world has kind of come to a stop. And all of a sudden, your patients are being forced to make some really hard decisions, go through some really tough stuff. And you don't get a lot of choice. No one really wants to make the decision between having one's bladder removed or potentially going through radiation therapy. No one wants to make the decision about having to accept chemotherapy or not. But unfortunately, those are choices that bladder cancer patients have to make. So while you may not get to choose whether or not you have bladder cancer, there are things that you can take care of and that you can control while you're going through therapy that can really impact how you feel, the success of your therapy, and kind of also how you feel emotionally going through it all. So in terms of nutrition, we know that good nutrition can help you basically feel better. It allows patients to maintain their strength and energy and maintain their weight as well as their nutritional stores, and we think it actually can really help maintain muscle mass as well. Patients who are feeling better are going to be better able to tolerate the treatment-associated side effects of chemotherapy, and this is important for doing things like reducing the risk of infection, which chemotherapy can put you at high risk for, and also potentially allowing you to better withstand the stress of surgery after chemotherapy to heal and recover faster. So I get it commonly, patients ask me, okay, so what do I do? What do you recommend? What's the best diet that I can take for my cancer? And the truth of the matter is there's no one perfect magic bullet here. There's no recipe that's going to make everything easier. And I also would really encourage people, I generally encourage people to really take a common sense approach, because this is something that ideally should be sustainable. And one thing that this can be a great opportunity is for patients to sort of take charge of their lives, get control back, and in doing so, make some changes that they can then maintain going through their therapy, but also afterwards, that will help them otherwise. So one of the first things I tell patients is the best diet for your cancer is actually a heart healthy diet. So there's nothing fancy here. There's no special supplements. There's no extremely restrictive diet. Moderation is critical, and you have to like what you eat because that makes people happy. But you do need protein. It should be about a third of all of the calories you consume or so. And ideally, this should be lean protein. So we're thinking about things like lean meats, chicken, and lean red meats if you're going to have those, or seafood products, but also thinking about vegetable-based proteins such as soy, that can be a great source of low fat, specifically low saturated fat protein. Fruits and vegetables are a big part of it, and definitely I think that the concept of sort of eating the rainbow is a great way to make sure you're getting enough fruits and vegetables. And then in terms of carbohydrates, whole grain and high fiber carbohydrates are great. So you want to be trying to avoid a lot of heavily processed foods, and a lot of foods that have unnecessary additives that they may be good or they may be bad, but they're probably just empty calories and oftentimes an unwelcome source of saturated fats and salt and other things that your body doesn't need as much of at this point in time. Hydration is critical, and actually we'll talk about it a little bit later, but one of the most common reasons people come back in, certainly during chemotherapy and absolutely after radical cystectomy, is because they get dehydrated. And so making sure that you're drinking enough fluid is really critical as well. And then good fats are okay, and in fact we really need them. Those are also building blocks that your body needs, but we want to focus on more vegetable-based fats. And so again, there aren't really any rules here. We want to try to avoid highly processed foods. One of my favorite food authors is an author by the name of Michael Pollan, who wrote The Omnivore's Dilemma that I'm sure some of you may have read. And he has some fairly simple rules for thinking about eating well that I think actually apply to bladder cancer patients. One of the things he said, eat real food, not a lot, mostly fruits and vegetables. And that's honestly the best advice I can give you. So in terms of if you want to look up on the web, what are great examples of diets? When people say eat the rainbow, the sort of high fruits and vegetable, very colorful plates are good things to be looking for, or the Mediterranean diet, which is very high in all of the things that I was just talking about. That's a great model to follow. You should always talk to your doctor about specific dietary plans or supplements before you start them, just to make sure that you're not doing anything that could potentially be problematic, especially because some supplements may not have listed all the ingredients that are in them. So we want to make sure that we want to make sure the supplements aren't going to interact with any medications or chemotherapy agents we're giving you. And we are more than happy to also refer you to a nutritionist, specifically a cancer nutritionist, to help you identify potential problems in your diet or things that could help you feel better.